Good morning, everybody. Welcome to the National Centre for Family Hubs induction session. I'm Anna Bedford and I'm one of the regional implementation advisors here at the centre, and I cover Yorkshire and Humber and the east of England. And I'll just hand you over to Julie, my co-host for this morning.
Good morning, I'm Julie Greer and I do a similar job to Anna. I cover the Southeast and Southwest as Regional Implementation Advisor, and I also have a sort of portfolio for special educational needs and disabilities. Good morning, everybody.
Thanks, Julie. So just before we begin, I'd like to just run through some housekeeping. Closed captions will be available during the webinar. Please click on the closed caption button I think it's at the bottom of your screen to enable the closed captions. The chat function is disabled. If you have any questions, please submit them via the Q&A function. There is also the option to vote for any popular questions, and we will come to these first. We will try and answer questions throughout the session, but we have put some time in at the end, so hopefully we'll be able to answer any questions that you have. The induction will be recorded and it will be available on Anna Freud's YouTube channel. Following the session, you will receive a copy of the slides where there's lots of different links that you'll be able to look at your leisure. If you have any technical issues, please put this in the Q&A and a member of our team will assist you. Right, I think we're good to go. So this morning's induction session is a little bit of a whistle-stop tour to think about the National Centre for Family Hubs and the support that we can offer. So this morning, we're just going to give a brief overview of Anna Freud, the National Centre approach, a little bit on the policy context of family hubs. We will identify the importance of participation in family hubs and then move on to our different resources. So we've got a range of online resources that you can access, and we will look at the regional and national support on offer. So the National Centre for Family Hubs is hosted by Anna Freud. Anna Freud was one of the founding child psychoanalysts, and she fled to Britain due to Nazi persecution. Anna Freud dedicated her career to helping children, particularly children who have experienced trauma. Now, Anna Freud is a leading centre for children and young people's mental health, and our mission is to close the gap in services through research, and there is so many resources on the Anna Freud website, and we've got links at the bottom, and we'll share links throughout the chat, throughout the session, sorry. So, yes, so we work with lots of different stakeholders looking at evidence-based research, and we provide training to health providers across the UK and the world. The National Centre for Family Hubs is hosted by Anna Freud and sits in the Early Years and Prevention Department. We are a national learning platform where our role is to champion the family hub model, disseminate learning and best practice through our publications and resources, and we will provide an overview of this throughout the session. This is just a breakdown of our team. We're a very mixed team, have a range of experience from early years, teaching, social work, researchers and counsellors. And this helps us to have a lot of different perspective when thinking about the implementation of family hubs across England. We also have two dedicated participation advisors, Dina and Naz, and we will talk about co-production in a little while. And I'll hand you over to Julie.
So as Anna says, this is really quite a whistle-stop tour, but I love this bit really. So I hope if I go on too long, Anna, just like hook me off with a hook or something, that would be good. So just thinking about what family hubs do. So family hubs were set up to support families from conception through the child's early years, right up to the age of 19. Now, those of you that will be familiar with Sure Start, for example, and children's centres, as you know, that was very much the sort of basis in those early years, the same as Start for Life still is now. But that the concept of family hubs and something that local authorities, both funded and unfunded, are really trying to get their head around is how do they continue that support? How do they help families in those years when their child's needs can really, you know, make life really quite challenging for them and for those around them. So that's the aim. So next click, please. And again, that sense of universal and targeted services, thinking about austerity when so many local authorities really needed to like maybe lose a lot of the universal and go into those targeted to those that most needed it. And what our families tell us, what so many families tell us, is that actually, particularly those in most need, want to be able to access in at the universal, so that they are familiar, they're not just being targeted. Now, of course, we know it's that juggle, isn't it, of making sure in terms of safeguarding that we meet all of those needs and we keep children safe. But before we get to that level on the sort of windscreen of need, before that level of child in need, then trying to make sure that we can offer as many universal services and perhaps target them in a way that targeting itself comes from the families themselves, so they start to recognize, you know, what other families they might want to link with, what sort of services they might want to provide, part of that co-production that Anna talks about. And the next slide, next click, and that sense of all families, but really making sure that for those who are disadvantaged, those minoritized groups, that we are making sure that we understand our own unconscious bias, and also we understand what to do to redress that, to make sure that through the language we use, through I guess the way in which we publicize and promote our family hub provision, that we are making sure that not only are we reaching everybody, but that what we provide is recognizable to everybody through the images we use and such like. Next slide, please. And just very quickly, again, you can sort of do a little bit of gathering around this, but again, really thinking of its origins, the origins of Family Hub, and bringing together all of these different services. Something that's not on there at the moment as well is attendance, for example, which is something that I'm particularly interested in as well. So thinking about how does family hubs fit into, how can they support all of these wider and really important policy changes and research that's going on at the moment. And I draw you in there particularly to the independent review of children's social care, for example. Integrated care system. So part of our job, Anna, mine and our team, is to make sure that we are aware of what is going on out and about, and thinking about how we sort of draw in all of these lines, looking like Spider-Man then, but holding them in together and making them make sense for you in your development of family hubs. Next slide, please. So the national rollout, you may be in a local authority that is funded. 12 local authorities are funded through Transformation 1 funding, and they themselves decided in a way what they wanted that funding to go towards. And then another 75 were identified by the government within England. This is only across England currently. And then of those 75, there are 14 Trailblazer local authorities. They've been identified. That is primarily for Start for Life services, ways in which they can make a real difference and share what they're doing with other local authorities. So if you're interested in who Trailblazer authorities are, again, get in touch with us and we can put you in touch with what they are saying that they are. They're good for, what the government's recognising that their provision is good for. And then, of course, evaluation is really important for us as well. Evaluating family hubs, evaluating our role, evaluating the role of the DFE, the DHSC, for example. And next slide, please. At the core of this is mentalisation. Now, you may know this by a sort of a variety of ways of thinking about this. It's really a sort of empathetic approach, and mentalisation is something that Anna Freud has really sort of taken hold of and offers training in, and is based in that sort of concept of attachment theory in a really practical way. You know, we're talking about how do we integrate all of these different sort of services that come together. And it's really thinking about how do you, for example, get yourself into the shoes of a midwife within the midwifery service, when you are, you know, a family hub support worker, you know, what does that mean? How do you recognize each other's needs so that we start to pull away from that, you know, he said, she said sort of conflict that can sometimes arise, not deliberately, not intentionally, but because we're not understanding enough about the different roles that we have. And so mentalization, both within how we work together as a workforce, but also in terms of how we build those relationships, how we better understand what our families' individual needs are, and how we can work towards improving our own behaviours, our own relationships, our own ways of working is so important. Next slide, please. And just very quickly here, access, connection, relationships. I've tried to drag them down, but I can't. They get it absolutely right, making sure. And I try and always think about the way in which we work as well, that we're actually trying to make sure that we walk that talk as well. And you can see there that all of our work is participation led. We work with local authorities, with those actually rolling out family hubs. We work with families, we work with young people as well. And we work with those who are working with families and young people to help make sure that we're hearing those voices. Evidence informed, really important. And of course, practice based, and you're part of that as well. So thank you. Next slide, please. I think that's back to you.
Yeah. So as Julie was just talking about the access, connection and relationships, one of the really key ways in making sure that that is fed through the family hub development is thinking about co-production and participation. And here at the centre, we really try to ensure that that's where our work is rooted, to understanding lived experiences of children, families and stakeholders in that development. We advocate and use what we call the London model of participation. So that's really about these 4 quadrants. So giving families, children and young people that space where they're able to share what's working well for them and what isn't in their community, and thinking about what are the service gaps, or, you know, what's going to work well, so that they've got that voice to express that. But then that's what, where does that go then? So that's thinking about that audience. So it's okay if we're gathering lots of different people's voices, but if that goes nowhere, or strategic leaders aren't in a space to listen and act on that, you know, this is where we really need to action, so that the voices of the children and families that we work with within the family hub development, you know, can influence that service. So a lot of the work that we do is about supporting local authorities in thinking about, are we understanding lived experiences? And we have Dina and Naz, who are participation advisors. So Dina is a parent participation advisor and Naz is a young person's. And they've written a really good blog, and there's a link within the slides. And I think one of the things that Dina highlights really well is that for lots of people that we work with, they don't even have that voice for lots of different reasons. They don't have the time, the energy, you know, or they may have additional needs in expressing what they need, and that's the challenge, and that's a challenge that we really embrace, but we really need to support in terms of making sure that when we look at support for families through family hubs, that we're looking at minoritized families and we're trying to understand their voice by creating that space. So there's lots of different work going on, and it's a really key theme that runs throughout everything that we do. I really like this visual. So this is thinking about how we develop hubs from local data. So as we just talked about, it's thinking about that lived experience. So where is it that families go for support? You know, do they go to local village halls or community centres, churches? Thinking about what works well and what are some of the gaps. Then thinking about, you know, professionals' experience. So part of participation and co-production is listening to frontline workers, volunteers, you know, anybody within the partnership. So charities, local, national charities. So thinking about that professional, you know, the professional experience, and also what is the local data telling us? Sometimes data can be boring and we get so, you know, there's so much to report on sometimes, but actually that local data can be really important in thinking about, you know, what are the gaps and goals for that effective provision. and so that we can really create those services that meet the needs of the family, that can be sustainable, and that we can see, improved outcomes.
I was just going to pop in
So
there
that's
as well, Anna. Can I just pop in
Yeah.
there as well? Because actually they don't have to be equal circles like they're shown there. That actually there might be, something where actually suddenly you have a huge amount of local data, and that's what's really informing you. And then while still important to recognise what's the professional experience and lived experience, it may be that this is what drives that particular change that you're thinking about, that development. In other ways, it might have been a project that you've done to really gather the views of lived experience, and then thinking about how your local data can support the wealth of information that you've got there. So I think it's just really important to, although it's a good diagram in the sense, we have to remember that think of them like balloons, they'll grow out, glow, and actually be careful sometimes not to overinflate them, don't you, as well? Thank you.
Yeah. Oh no, that, thanks, Julie. So that's just a little bit about the background to Anna Freud, the National Centre, and really emphasising that relational based practice and how we work with local authorities in supporting that implementation of family hubs. So we're now just going to move on to look a little bit more on the practical resources that we have on offer. So we're just going to just talk a little bit about our implementation toolkit, case study library. Within that, there's also resource library and a little bit on YouTube. So I'll hand you back to Julie.
Thank you very much. So you may have already clicked on the implementation toolkit, and I know that you've we've got a link to that in the chat. A link to that in the chat. Oh, I've got feedback. Are other people hearing that feedback? No? Oh, no, very strange. Apologies. I could just hear my voice coming back several seconds later, so it seems okay now. As I say, you may have you have got the link to the toolkit in your in the chat there, and we're really proud of the toolkit. And I think as well, what is important is that we keep returning to it. They're not done, they're not finished. They are things that we need to come back to and recognize as we learn more, as we, as other research comes into play. For example, it's making sure that we reflect on that. And I know from my own point of view, with that sort of send hat on as well, is, do we have that built into enough of our toolkit as well? It shouldn't just be the send module, but actually, are we able to have enough recognition of send needs throughout all of the modules? And this again might be something that you can take forward into your development, thinking about making sure that what are your really key policies that you want built in and not just bolted on. Next slide, please. So as it says here, we've worked with local authorities, certainly to develop these. We've worked with young people, we've worked with families. And again, we have to think that gets a really important part of participation. You're not, if you're speaking with families, for example, as I did when putting together the send module, they're not representative of all families who have one or more children with special educational needs, but they are representative, and so their views, their voice is really important to capture. But we also have to recognize that doesn't capture the whole gamut of everybody. So, and it's why I think it's important that they are still we are still able to work on the modules, so that as we learn more, hear more. So yeah, next slide, please. So again, you've got an overview of modules, and we're building on those. Do remember that what you see on that first page is only a sort of the first block, if you like. So make sure that you click on more modules if you can't see what you want yet, and there are there are more to be added as well. So next slide, please. So it just gives you a little idea of how we've sort of laid these out so far. And thinking about how, if you're starting your journey, then you might want to start at the background information. All of the modules are, they're designed to be accessible. They're designed to be fairly easy to read, and to be sort of to make makes sense. So again, once you've got into one, it might be there are links within them. It might be you want to find more out about a certain thing, and if as well, we often run communities of practice as well. But it might be that you want to let us know that you want to know more about a certain aspect as well, and we're really open to hearing about that. We've got the strategic golden threads, and actually making sure that those aspects, you know, leadership, governance, theory of change, they run across everything. Access and inclusion, as we talked about, those really sort of built-in aspects. And then we got practice approach, so you're sort of thinking again about more specifically how you might approach certain things. And schools, for example, is one that we're working on currently. And ingredients for successful implementation as well. And we hear from lots of our local authorities, they're really wanting to get their head around workforce in particular, as an example. And lots of local authorities really sort of getting excited about virtual and digital delivery. And I just muse on whether, you know, actually the downside of a pandemic, aside, the upside being that people are much more confident, as we are here today, you know, being able to really go for that virtual and digital delivery in a way that wouldn't have even been thought possible 3 years ago. Next slide, please. So yep, just thinking about the Family Hub development process, and I think that's a really good place to start, and thinking about, it sort of talks you through how you can approach it if your local authority hasn't yet sort of begun, or it's sort of had a bit of stop starting. And I think it is, you know, for many people within the field, you know, myself included, you know, you have some sort of you know, you have a history of understanding how you thought Sure Start worked, or how you thought children's centres work. And this is an opportunity through this sort of development process, through this theory of change, to go back and think about, okay, what are the local needs? How can we better understand them? How can we make sure that what we're providing will meet the families' needs within the resources that we've got? And of course, you know, sadly, that's a very real aspect for us as well, for you. So to bear that in mind. And next slide, please. This is whistle stop. So whistle stop. So anything that you're like, what were they talking about? Do get in touch with us. Do come back to us, and we can explain in more detail. And again, sort of thinking about the special educational needs and disabilities, and really trying to bring that alive, and we do hear from local authorities. I mean, I would love to say I can point you to this local authority because they've really cracked it, but as you know, everybody is really trying to make sure that their good practice, their effective practice, can grow and build and go across sort of all the services for families where there is a special educational need or disability. And that's incredibly challenging, incredibly hard to do, not least because of that I guess that growth in need. We know that the number of children and young people with special educational needs and disabilities is really growing. We are aware that more and more children and young people are having diagnosed needs, but we're also aware that more and more families are recognising needs that may or may not have a diagnosis as well. And it's about how we can support families and support families together, families supporting other families, to really make a difference. So the module itself, in many ways, there's a huge number of questions in there, as well as, to prompt your thinking, because there isn't, I wish that there was a guide I could put out there and say, do it like this and it'll all be brilliant. But it really is about making sense for your families within your local authority as well. And again, would love any feedback on any of the modules, but from my point of view, particularly the SEND module as well. So next slide, please. So currently Anna's email is there, and Erica, another our colleague, who are working on these with us, with other colleagues as well, sort of feeding into that. But modules in development at the moment, as you can see there, children's social care and schools, really important, VCS and faith communities, spaces and co-location, you can see it all there. And sometimes we're doing that work individually with local authorities as well. Next slide, please.
Thanks, Julie. Yeah, so like as we keep saying, that was a quick overview of our implementation toolkit. And yeah, please have a look and think about, you know, is there anything more that you feel would be helpful to local authorities? And yeah, please do get in touch with me. As well as the implementation toolkit, we also develop different case studies. So thinking about case studies as part of the Family Hub development, but also how case studies in wider partnerships or in different parts of the service can help us think about how we could apply that to some of the development. So, you know, if you go onto the website, onto the case study section, you know, scroll down, as Julie says, you need to kind of keep going because there's lots of different ones on there, and we're developing them all the time. So, you know, thinking about like why we do case studies. Well, we want to showcase the innovative and creative practice that is happening. There's so much good stuff that is going on in terms of Family Hub development, and I've just been supporting a couple of local authorities to write case studies about their engagement when they've been launching the Family Hubs and how they've reached out to families, and families have come in and who wouldn't have normally gone to a children or family centre, you know, and really embracing that opportunity to try and do things different. So I think sometimes when you read something that's quite creative, it sparks your thinking and thinking what you could do. So that's really one of the key reasons why we develop the case studies. And we want to put practice into context. So we want to highlight what some of the challenges and successes are. So when we think about case studies and case study development, we're really interested in the how did you do that? What were the processes? Because that can then support other local authorities to think about what they're doing. So it's trying to say so that in a way, if you're going to do it, you know, these are the mistakes that, you know, we'd advise you not to repeat, you know, because that's always helpful, you know, because there's no point everybody kind of doing the same thing and all coming up with the same challenges. You know, the case studies really link into resources, the other resources. So, for example, we've got a module on theory of change, and Norfolk have done a really lovely case study about how they work through the theory of change, and you can see the different workshops they did with the stakeholders and how that developed. And yeah, you know, it goes without saying that, you know, we're trying to support the development of Family Hubs. And when we think back to that triangle a few slides ago, you know, the participation led, so we're listening to children, young people and families. So whenever we're doing case studies, we want to see what the feedback has been from the families who it's impacted on, you know, hearing from local authorities, voluntary community and faith groups, you know, thinking about that evidence, you know, what has been the impact, you know, how have those challenges overcome, and thinking about that practice. So it's Family Hub development in context, because like I was saying, we're quite a diverse group in our team, but we're not the experts in implementing Family Hubs. We need the expertise of people that are experiencing it to move that forward. These are just some of the topics. So yeah, we've got them on governance, outcomes and evaluation, leadership, and we're developing them all the time. So this isn't an exhaustive list. If the things that you're interested in, you know, there may be case studies for you. And like I say, you know, as Family Hubs develop, we really hope to build on that library.
I was just going to look in there as well, Anna, thinking that actually, you know, you're all here presumably because you're quite new to Family Hub development, new in post, for example. Actually, if anyone was you know, interest or willing to write even a short blog about being new in the business, being new to family hubs, and thinking of that as a short case study, we'd really welcome that. So
yeah, definitely. And that's something that I'm keen to set up, maybe a community of practice for practitioners, so people that are, you know, working directly with families, whether it's volunteer or, you know, frontline. Yeah, that's definitely something we want to hear about. And yeah, this is just a spotlight on a case study that Durham completed for us. And this isn't about family hub development. It was a whole system-wide change, but it was about how to include dads and male carers in their work, because they've done like a survey. I think it was like a general survey about services, but only 4% of the respondents were male carers. And it really prompted that thinking of like, how do we change our narrative? What do we do to think about how we engage with dads and male carers? And the work they did had some real impact, with more male carers volunteering for the Empowering Parents, Empowering Communities, the EPEC parenting support, you know. And here we've got a quote from a dad. So really trying to listen to what families and the male carers were saying about the work that they did. And, you know, you can access the full case study on the link, and also when you get sent the PowerPoints. So
Anna, I was just going to say, are you able to just click back very quickly into that? I was just thinking that quote is really lovely, isn't it? And actually a really good example of that mentalization that I was talking about, you know, right back at the start. Actually, that's what we want to be able to do, isn't it? As workers, that we don't make anybody feel blame or their fault or embarrassed. And actually, to do that, you have to build that relationship and be able to, I suppose, both be able to stand in their shoes, but also enable them to stand in your shoes. And it's the two-way of mentalization that I think is really important, because the danger of just empathizing is that it can quickly just become sympathy. And if you're sympathizing with somebody, that doesn't lead them to want to, you know, to feel an equal part of whatever's, you know, going to happen next. So just they're really subtle differences, but really important.
Thanks Julie. It just makes me think about the access, connection and relationships, and and I guess that quote encompasses that. Thanks. And this is really just an outline of some of the questions that we ask, or we want local authorities or organisations to think about when thinking about case studies. So again, like Julie was saying, you know, you may be new to family hubs, or you may have transitioned into a family hub practitioner, but you might think actually what we're doing in our area is a really good piece of practice, and I want to showcase that. And sometimes I wouldn't say resistance, but sometimes it feels vulnerable if you're saying this is best practice or this is perfect practice, because that's never what it is. You know, it's about what, you know, what is working, and can that be shared or adapted or applied in other areas. So I think sometimes when we say, oh, we want to look for best practice, it can make people feel a little bit vulnerable to sharing. But what we really would welcome is local authorities or organisations to get in touch, because the more we know, the more we can learn, and the more that we can develop. And we also have a YouTube channel where, if you want, you can rewatch this induction in your own leisure, but there's so much good stuff there. So we talked about the London model of participation. There's a full webinar thinking about that in reference to family hubs. On the screen is just a short video showing a family hub in Westminster. So there's lots of different things. So please have a look, have a watch. There's some really great stuff. And I'll just hand you back over to Julie, who's just going to guide us through some regional and national support.
Lovely, thank you. So you can see we're dotted around the country as regional implementation advisors as well. So we can put you in touch with your local person as well. But as Anna says, we each have different sort of specialisms, you know, prior careers as well, that we bring to the work that we do. And we're very lucky that we can share that expertise with each other as well. So next slide, please. So you can get in touch with us, and I think that links to our emails, I think. But we are also able to communicate, facilitate communities of practice. So, for example, this afternoon, I'm going to be working with colleague, or rather family hub development colleagues in Cornwall and in Dorset, and we're going to be running a Southwest community of practice, and today's is a focus on SEND as well, for example. And those communities of practice happen regionally around the country at different times as well. Sometimes we can have shorter ones. Sometimes, for example, I gather there's a few local authorities, unfunded local authorities primarily in the Southwest as well, that come together regularly as a huddle, just to sort of share what they're doing, support each other, one-to-one support. So again, that can be, you know, really diverse. I'm working with a local authority, for example, looking at some of their buildings review. And just on that, actually, because I was talking again with a colleague in Cornwall, and she was saying that she'd been advised to go into all of the family hub buildings that she was looking at on her knees, again, just to get that perspective, looking at what it looks like. I spent many years as a head teacher, and frequently would do that, going into a classroom. So what do you see from a child's point of view, for example? And that sort of, you know, way of approaching things, another good example, if you like, of mentalization. And consultancy, you know, we are here to help you with your requirements. Sometimes that, or mostly that, will fall within the remit that we are funded to provide, but there may be something additional that your local authority, or a group of local authorities, or a group of we're currently doing some consultancy with some public health and health sector workers, for example, and there may be an additional cost to that. But get in touch with us and see how we can help. Next slide, please. And again, we're about to have a national conference. We were hoping to have that in person in Manchester, and that was going to be a sort of hybrid. But unfortunately, due to an upcoming train strike, that's now all online. So everybody is welcome to come to that. So do have a look on our website and join in where you can. And there are also thematic communities of practice. So we're going to be running a community practice on attendance in November. Anna and I are running one on, what's our next one on?
We're doing one on rurality in family hubs.
Rurality, that's right.
Yeah.
And again, working with some local authorities to help us, you know, do those as well, which is great, so that we're really being led by others. So and the Family Hubs online network, where we have a team space. If you want to be on that, if you want to just ask questions, see if someone will, you know, get back to you, again, email to sign up. So that's it from me, I think. Over to you, Anna.
Yeah, so that's it really. So we just want to say a massive thank you for coming. And there are some questions, a couple of questions in the Q&A function. So and yeah, if we've got about 5 minutes, so if you've got any more questions, please submit them now. We will get the link to the Lundy model webinar. We'll try and put that in the chat, Beatrice. So yes, so Dawn, in terms of that regional support, we do offer one-to-one support as part of our role, so that's free to local authorities, and the consultancy does come, you know, with additional costs. But what I would suggest is get in touch with your regional implementation advisor, and you can have that discussion, because it's quite bespoke, and there's not, you know, so it's about having those conversations and thinking about what's going to work for your local authority. But yeah, definitely we are able to support. And Amy, thank you for putting a little bit about your role as a VCSE strategic coordinator. I am the regional implementation advisor for Yorkshire, and so it'd be really good to connect with you outside of this session and hear about your role. And yeah, we can think about whether there are other practitioners in similar roles across the country. So yeah, we can try and reach out and do that.
Absolutely. I was going to say, certainly both funded and unfunded, you know, aware of a number of local authorities who work directly with VCS, or their family hubs are run by VCS. So a really good example is Bernardo's on the Isle of Wight, for example, and we can certainly connect you with them, but there's like I say, that's not an uncommon picture, so it'd be really good. And maybe again, Amy, you've just sort of prompted me to think that maybe, you know, that would be another really good community of practice for those working, not direct, you know, working for being commissioned by local authorities, but they're actually being run by voluntary sector organisations.
Great. Mike, yeah, we'll try and get the link for the Norfolk case study. If we can't do it live in this session, we'll get that out with the slides. Because I think when you go onto the case study library, you might need to scroll down or load more. I can't remember what it says, but it should be there somewhere. And Lou, in terms of communities of practice, yeah, you could email the enquiries line, and then we can get in touch to say these are the ones that are happening. Sometimes they're advertised on the website, but it's dependent. So yeah, if you email the enquiries email address, we'll definitely be able to get in touch. And then a message, comment from Saray, apologies if I've not pronounced your name properly, but yeah, it's a parent of 4 children using service, happy to share back feedback. Yeah, definitely. If you get in contact either the National Inquiries line or contact your regional implementation advisor, we're really interested to hear your views. Yeah, definitely get your feedback.
I've put the YouTube link into the chat and also a slide there to you, and I'm just trying to see Norfolk case study. Yes, I think if Anna gets back to you about the Norfolk case study.
Yeah. Yeah, I think I'm definitely not the digital or virtual expert, but yeah, if there could be a search facility, that probably would be a lot better. I don't think we've got one or got I don't know whether we will have in the future, but I can definitely put that case across. And Lou, yes, we do have a case study template, and if you email me, I can get you one across.
Really good questions, thank you.
Yeah, yeah, great. So yeah, so I think that is it. I'm just scrolling down. Yeah, no more questions. So just want to say thank you and all the best on your Family Hub journey. And yeah, hope to see some of you in the future, either at communities of practice or writing case studies or yeah, anything. It's really great to see you.
Thank you so much, everybody. Enjoy the rest of your day.
Thank you.